We have just 4 or 5 hospitals maximum in Aleppo city, serving at least 500,000 people. So by this kind of attacks, people will not have access to the health care. And even if they are being treated in a hospital, they will not feel safe. And on the other hand, it will affect the availability of the medical staff, because now in Syria, it's so hard to find any medical staff. For Save the Children, we run 7 centers in Syria, and it's really hard to find one pediatrician or one gynecologist. And in this attack yesterday, the only pediatrician left in Aleppo city was killed, Dr. Wasim Maaz, who is the only pediatrician left in the city. So you can imagine that this 500,000 people will be having no access to the health care, and there will be no medical staff to treat them.
You know, there's reports of a build-up of government forces in and around Aleppo, and there is talk that there may be a major assault on the areas still in rebel hands. What would such an assault do to that civilian population there?
Actually, the problem with this kind of news that it came just after the ceasefire. Because after the ceasefire, people, they had some hope. And some of them, after they left Aleppo, after the ceasefire, they came back. And after quite a few weeks of having no airstrikes in the city, more people, they came back. So now Aleppo city, it has more population than before the ceasefire. So by having this idea of attacking Aleppo city, they are pushing the people to either leave the city, or people who have no other option, they will die in the city. And we heard a lot of people, they said we prefer to die in our homes rather than had to die in a camp, because even the camps sometimes it could be a target.
You know, I just wanted you to expand on that comment you made about how this impacts, you know, the availability of medical staff. I mean, what does that conversation sound like, especially when you have so many aid groups now who really can't guarantee the safety of medical workers, aid workers?
Absolutely. I will give you one example related to Aleppo city itself. Aleppo city is a city before the crisis. It has at least 4 or 5 million people, and the number of doctors there were up to 5,000 doctors. And now when we are talking about the rebels areas or the opposition-controlled areas in Aleppo city, we're talking about 500,000 people with just 25 doctors. So you can imagine that each 20,000 people, they have just one doctor to treat them. And by this kind of attacks, even the brave humanitarian actors and the brave doctors who decided to stay there to serve the people, they will think again about fleeing out of the country, because a lot of medical staff, they left already. So just the leftover people, they will think again about leaving, because their colleagues are being targeted on daily basis. And I can remind you with the targeting of Dr. Hassan Al-A'rar just 2 weeks ago. His car was targeted. He's the only person there. So it seems that it's really a targeting for the medical personnel and medical facilities, which means all medical staff will not feel safe to continue serving the people.
So you think it is deliberate targeting, and you're not the only one who thinks that. I'm curious, Amra mentioned this before, but aid, equipment and supplies and food even, it's very difficult to guarantee entry points for that. What is the situation with supplies?
Yeah, if we are talking about Aleppo city itself, you can imagine that even ambulances, when they will be entering the main entrance for the opposition-controlled areas to Aleppo, it could be targeted. So what about the trucks who's delivering the supplies? It could be easily targeted.